Welcome back to the ASCO Journal of Oncology Practice podcast. This is Dr. Bob Miller of Johns Hopkins and consultant editor for the JOP. Lymphedema of the arm is one of the most feared complications of axillary lymph node surgery for breast cancer patients. One reason it is a difficult problem is that there is insufficient research about its prevention and management. Consequently, clinicians are often required to make recommendations to patients without evidence-based guidelines about effective prevention strategies. In the March 2011 issue of JOP, we feature a literature review of some previously published randomized trials studying the effect of exercise on the development of lymphedema in women who had undergone axillary lymph node surgery for breast cancer. For this podcast, I'm pleased to have as my guest the author of this article in JOP. Kristen Cavanaugh has been an oncology nurse since 2003, working at both Memorial Sloan Kettering Cancer Center and the Dana-Farber Cancer Institute. She's a graduate of the University of Pennsylvania's Acute Care Nurse Practitioner Program. She currently works as an NP in the Breast Cancer Survivorship Program at Memorial Sloan Kettering. And thanks for joining me this evening, Kristen.
Thanks, Bob. It's great to be here.
First, tell me a little bit about your own personal experience as a nurse practitioner at Memorial who treats breast cancer patients. How much of a problem is lymphedema of the arm for patients in 2011?
We tend to see it in lymphedema in patients in varying degrees. For the most part, most of the patients that we see have very mild cases of lymphedema, I would say. Patients report that they feel a tightness in their arm, or they notice that their rings or watches feel a little bit tighter than they previously were prior to their surgery. We don't see a whole lot of real severe lymphedema. And I think that's in most part because of the refined surgical techniques that we have available now, as well as the much more targeted radiation. I think there's also a lot more knowledge and resources available to us in terms of preventing it and treating lymphedema as soon as the symptoms start to come, and prevent it from developing into something that makes the limb almost unfunctional for some patients.
Do you encounter patients who have had lymph node dissections who are really afraid to exercise and who sort of voluntarily restrict their activity about the use of their involved arm?
So oftentimes we come across patients who report that they have been restricting the movement of their arm. One of the benefits of the survivorship program that I work in is that we really focus on health maintenance and a healthy lifestyle. So we often ask about their exercise and how much exercise they do and what types of exercise. And I think we're really the first ones to really ask patients about that. They don't get a whole lot of that when they're going through their chemotherapy or their surgery, asking them if they're exercising or lifting weights and things like that. So we find that some patients they're given the information at the time of their surgery on top of a whole bunch of other information. So it kind of gets lost in the shuffle, I think, or they place it aside for the future. And by the time they come to us, they're a few years out, and they've kind of been avoiding exercising for some time just because they don't really remember what they were told, or they couldn't find the paperwork that they were given. And if they do have some questions or concerns about it, they often go to the internet or talk to their friends about it. And so they may not be getting the most accurate information, what restrictions there are, or what they can and can't do. So we do see some people who are surprised when we ask them if they exercise, or surprised to find out that we encourage them to exercise and use their arm.
Do you think you actually have very many patients where their providers have very specifically told them not to exercise?
We typically don't, because all the patients that are being referred to us are from within the institution, and our general practice is to encourage patients to resume their normal activity after a few weeks after. However, it does seem that searching online and things, there's a lot of message boards and websites and things of that sort that patients discuss things about or advised to limit their movement, not to lift heavy things, not to carry small children or heavy bags, or even participate in sports like tennis or golf or things like that.
So your paper in the JOP was basically a literature review of 4 different research articles that had compared restricted movement versus exercise. And maybe you could just briefly summarize the major findings and the limitations of the papers that you cite.
Sure. So all 4 of the studies that I reviewed were randomized controlled studies, and all of them randomized patients to either some sort of exercise or stretching program versus limited movement, or not providing patients information on how to stretch or how to perform the exercises. There was only one article actually reported that there was a statistically significant increase in the development of lymphedema in the control group versus the intervention group. The other 3 articles reported that there was no difference in the development of lymphedema between the 2 groups. So participating in these exercise programs of progressive weightlifting or resistance training didn't increase the risk of, or didn't increase the development of lymphedema in patients when was compared to patients who did restrict their activity and weren't lifting any weights or performing exercises.
Mm-hmm. Okay, that's a pretty positive finding. That's very encouraging to hear that.
It is very encouraging. That being said, the studies were all quite small. The patients were not followed very long. Lymphedema is a chronic issue that can develop years and years out of surgery or after patients complete their treatment. The longest follow-up in the articles that I reviewed was for 2 years. So despite the limitations of the study, it was found that there is still no increase in the development of lymphedema in the intervention group when compared to the control group.
I want to ask you about another article. This was not one of your references because it came out, I believe, after your article was submitted. But I think many of us saw this article by Catherine Schmitz, which was in JAMA in December. And this was actually a randomized trial. This is for patients, breast cancer patients who had undergone lymph node dissection, and they were randomly assigned to a control arm or to progressive weightlifting. It was a very encouraging study that there clearly was if anything, a lower incidence of lymphedema in the women who were randomized to exercise. So can you maybe just make some brief comments about that study relative to the studies that you had reviewed?
Yeah. So I think the results of this are very promising, and it's a great starting point for us to have some good data in terms of being able to give patients good information on why these recommendations are changing, and it's a great starting point to have this information to be able to change the recommendations that we give patients, and providing patients with some concrete information that helps support them resuming their regular activities and going about their life as they did previously.
Mm-hmm. Based on your research and the findings in the Schmitz paper, what are you currently recommending to your patients about arm exercise following lymph node dissection?
So patients are given extensive teaching at the time of surgery. They meet with the nurse, are given a lot of information on what to expect, and as well as some printed materials on how to perform stretching and how to care for the arm to prevent lymphedema. Patients who are in the hospital go to a exercise class to learn the exercises and stretching that were recommended. So initially after surgery, patients are encouraged to perform some stretching of the arm and shoulder just to prevent any tightness and keep their shoulder moving and everything. They're encouraged to use the surgical arm for daily activities such as eating, brushing their hair, bathing. And typically, the information they're given is to do this stretching for about 4 to 6 weeks. After that, they're really encouraged to check in with their medical team before resuming more strenuous exercise. But the general practice is that providing they're healing well and not having any complications, they're allowed to resume previous activities. That being said, start at a lower weight. If they're lifting weights, we encourage them to really start lower and build up on the things. So start things a little bit less intense.
Okay. I've often thought that many clinicians probably underestimate the risks of developing lymphedema or even the impact once it develops. And there's a perception that some of these recommendations about lymphedema prevention aren't very evidence-based, or, they're anecdotal. What are your impressions about provider attitudes these days about lymphedema prevention? I mean, it sounds like you're at an institution where this sounds fairly standardized.
I'm very lucky to be where the occupational therapists and the physical therapists are very educated on the treatments. And so we're able to refer people quite quickly and get them in a treatment program right away. I think it's much more difficult for providers who don't have these types of resources. And there's not a whole lot of information out there on what the classifications of diagnosing lymphedema are and how to initiate treatments and what steps to take to treat. So I think the articles that we've been talking about today will serve as great resources for our providers to have some information so that they're able to give their patients some evidence of why they're making recommendations, as well as initiate treatment programs sooner and make recommendations to patients on how to prevent lymphedema and how to treat it.
Kristen, thank you for joining me tonight.
Thank you. It's great to be here.
And to our listeners, I encourage you once again to take a look at the entire March issue of the JOP for some great articles on diverse topics such as the off-label use of rituximab, a clinical trials complexity rating tool, and a summary of the recent ASCO guideline on bone-modifying agents in metastatic breast cancer, which was the subject of our last podcast. As always, send your comments to jopeditorsdesk@asco.org or comment in iTunes. This is Dr. Bob Miller for the American Society of Clinical Oncology. Thanks very much for listening.